Assalamu alaikum student. We are going to discuss today the last topic in GIT pharmacology that is related with drugs which are stimulating gastrointestinal motility. They can also be termed as prokinetics, and these are also important for the treatment of constipation. The agent that can selectively stimulate gut motor function, also known as prokinetic agent, they can be used for GERD, gastroparesis, ileus obstruction, and constipation. The receptors regulated in GIT modality including sympathetic and parasympathetic extrinsic nerve fiber. There are 5-HT3 receptors which are mainly involved in nausea and vomiting. 5-HT4 stimulation enhance the release of acetylcholine and calcitonin gene-related peptide, promoting reflex activity in central nervous system as well as enteric nervous system. Another receptor which is found in the GIT modality is the dopamine, which is an inhibitory neurotransmitter, hence decreasing the intensity of esophageal and gastric contraction. Now come to the classification of prokinetic agent. These are classified on the basis of their mechanism of action. Cholinomimetic agents are those which are increasing the GIT motility by acting as a acetylcholine agonist or initiator. The most common agent which is included in cholinomimetic agent is the acetylcholine esterase inhibitor, which is the enzyme responsible for the degradation of acetylcholine neurotransmitter. The agent in this class is neostigmine, and the most common use of cholinomimetic agent is in GERD and gastroparesis. Other cholinomimetics are those which directly acting as an agonistic effect at muscarinic 3 receptor, and the agent in this class is bethnacol. Again, it is used for the same purpose like the cholinomimetic agent. Metoclopramide or domperidone. These are D2 receptor antagonists and acting in GIT as well as in the chemoreceptor trigger zone. They increase lower esophageal sphincter pressure and enhance the gastric emptying, but have no effect on small intestine or colonic motility. Therefore, they are used in GERD, vomiting, and nausea. The third class is macrolides, which are including erythromycin, directly stimulate motilin receptor on the GI tract smooth muscle. They are given usually by intravenous route in gastroparesis. However, tolerance rapidly develops because of its antibacterial activity. In the upper GIT hemorrhages, these are given to promote gastric emptying of blood before endoscopy. Now come to the next problem which is associated with the GI tract is the irritable bowel syndrome, which can also be abbreviated as IBS. IBS is an idiopathic, chronic, unknown cause relapsing disorder which is characterized by abdominal discomfort, starting with the pain, bloating, distension, or cramp, in association with alteration in the bowel habit, that is diarrhea, constipation, or both. Therapies of IBS are directed at relieving the abdominal pain and discomfort and improving the bowel function. So these are the two main focus for the therapeutic approach of IBS, because IBS is a problem that starts from the upper portion of the GI tract till the anal area of the GI tract. So there are different type of problems that arise, or it is a multiple type of disorder related with the complete GI tract. Usually, treatment is done on the basis of symptomatic. For the diarrhea, we use antidiarrheal agent, especially loperamide, which help in reducing stool frequency and fecal urgency. In case of constipation, fiber supplements to soften the stool. And in case of increased gas production, bloating, and abdominal discomfort, osmotic laxative, especially milk of magnesia, is given. For the chronic abdominal pain, low doses of tricyclic antidepressant amitriptyline, which cannot affect on the mood at the low doses, which are about 10 to 15 milligram per day, but it may alter central processing of visceral afferent information. The anticholinergic properties of these agents also may have effect on gastrointestinal motility and secretion, therefore reducing stool frequency as well as liquidity. So, in the chronic pain which is associated with IBS and the patient is experiencing constipation, tricyclic antidepressant agent, specifically amitriptyline, in the low doses are effective to reduce the motility and secretion, as well as it helps to reduce the stool frequency and liquidity. Along with this, it is seen that amitriptyline is effective for the treatment of gastrointestinal motility and secretion in IBS, in those IBS conditions where diarrhea is mainly involved in the symptoms, as it is reducing stool frequency and liquidity. Now come to the specific treatment. The specific treatment can be done by taking antispasmodic or anticholinergic agent that relieve abdominal pain or discomfort. The agent including is dicyclomine and hyoscyamine, which inhibit muscarinic cholinergic receptor in the enteric plexus and on the smooth muscle, so it can minimize the pain. At the low doses, they have minimal autonomic effect. At higher doses, they exhibit a significant additional anticholinergic effect, which include dry mouth, visual disturbance, urinary retention, and constipation. For these reasons, antispasmodic are infrequently used. The second agent which is used for the treatment of IBS as an specific treatment is the serotonin 5-HT3 receptor antagonists. They act by inhibiting the afferent GIT 5-HT3 receptor, results to reduce unpleasant visceral afferent sensation, including nausea, bloating, and pain. Blockade of central 5-HT3 receptor also reduces the central nervous system responses to the visceral afferent stimulation. In addition, 5-HT3 receptor blockade on the terminal of the enteric cholinergic neuron inhibit the clonal motility. Aldosterone 1 mg per day or twice per day is approved for IBS diarrhea, predominant to control pain, cramp, urgency, and diarrhea. So all those IBS which are associated with the diarrhea, 5-HT receptor antagonist aldosterone is very important in such patient. The third compound or the agent which is used specifically for the treatment of IBS is the chloride channel activator. Lubiprostone or 8 microgram twice per day stimulates the type 2 chloride channel in the small intestine, which are abbreviated as CLC2. It is approved for women with IBS with constipation. Its efficacy for men with IBS is unproven. Lanacolotide 290 microgram per day and guanylyl cyclase C agonist for adult IBS with constipation is effective. The role of these are uncertain in IBS. They are high due to their higher cost, lack of long-term safety, efficacy information. So therefore, these drugs are not considered as the good choice for the treatment of IBS. Now come to the next problem, or the last topic in this section of GIT pharmacology, is the cholelithiasis. Cholelithiasis is the presence of one or more calculi which are gallstone in the gallbladder. In developed countries, about 10% of the adult and 20% of the people which are above than the age of 65 years have gallstones. Gallstones tends to be asymptomatic. The most common symptom is the biliary, colic or biliary pain. Gallstones do not cause dyspepsia or fatty food intolerance. But gallstone can block the duct and the normal flow of the bile into the intestine. Therefore, they can create problem in fatty compound or the fatty substance absorption. The muscle cell in the bile duct contract vigorously to try to move the stone, which can cause pain of the biliary colic. The management of the pain is the main concern of treatment in the cholelithiasis. The first choice of medication for the treatment of biliary pain or the colic which is associated with the gallstone is the NSAID such as ibuprofen. The second choice is antispasmodic agent like scopolamine, which might reduce gallbladder spasm. It is necessary that we need to prevent the synthesis or the formation of gallstone. Cholesterol appear to play a main role in the formation of gallstone. If it is not properly discharged into the GI tract, it will ultimately store in the gallbladder, and resulting is the synthesis of gallstone. It is advisable to avoid eating too many food with the high fat content. High intake of citrus fruit like oranges and grapefruit can reduce the formation of a stone because of the vitamin C, which is involved in the synthesis of continuously or the conversion of bile acids. And once bile acids or bile salts are synthesized, they can easily be eliminated and removed from the gallbladder into the intestine for their further mechanism. So this is all about GIT pharmacology. The last word which I usually end is on the quote of the day. So today's quote of the day is, worldly life is short, so turn to Allah before you return to Allah. Thank you so much.